Hey everyone, scary scene Friday for White Sox pitcher Danny Farquhar. He passed out in the dugout and the team tells us that was brought on by a brain hemorrhage caused by an aneurysm. You might be asking yourself, what exactly are those things and could they happen to me? A hemorrhage is bleeding and an aneurysm can cause that bleeding on the brain. Dr. Babak Jerome, a professor of neurosurgery at Northwestern Memorial Hospital, is here to help explain.
Brain aneurysm resembles a small blister, a pimple that grows off the side of a blood vessel. This is where a blister could grow over many years as blood comes in this path and divides.
And at some point, that blister could burst. Dr. Jerome says blood then leaks on the brain and creates pressure inside the skull. That combination leads to several possible symptoms, like headache,
nausea, vomiting, drowsiness, sleepiness, even coma.
And in the worst cases, this leads to death. This can happen no matter what you're doing.
We've seen a lot of patients who are literally lying in bed or reading or sleeping when their aneurysm burst.
There is some good news. Dr. Jerome says about a third of patients make a full recovery over time. Dr. Mamta Swaroop, an associate professor of surgery at Northwestern University's Feinberg School of Medicine, had such a scare in 2015.
I had the worst headache of my life. I barely remember the ride to the hospital. I saw my mortality in their eyes. And when they told me that they loved me and goodbye, that's when I got scared.
But thanks to her quick decision to go to the hospital, she had surgery and began to recover. Then the aneurysm came back. But after more treatment,
I'm 100% back to operating, coming from someone who literally had to put one foot in front of the other day by day. You can do it. You can do anything.
Unfortunately, Dr. Jerome says no one's figured out what causes an aneurysm, but there are warning signs.
If you have high blood pressure, if you smoke, if you have polycystic kidney disease, or if your family members have had brain aneurysms, you're at a high risk of having a brain aneurysm yourself.
Dr. Jerome says a family history of aneurysms or new headaches would be reason to get screening. So if that's you, reach out to your doctor. In the newsroom, Jesse Kirsch, ABC 7 Eyewitness News.